Yeah. Perfect. All right. Hi, Minnu. This is our next Fellows in Focus Spotlight with Minnu
Yeah,
Monu. Welcome.
thank you.
I really enjoyed getting to know the different fellows, and this is expected to be what we want to do out of this is, one, it allows our faculty to get to know people, and as you said before we started recording, you get to know some of your other fellows in ways that you didn't know about.
Yeah,
But also we hope that this will give us an opportunity, particularly with recruitment, oftentimes, and for the sake of the future still seeming to be mostly virtual, it's hard
yeah,
for fellows to get to know us when we don't get to see them in person. And so
yeah,
that's the vision here. But
yeah.
anyways, for that, we'll kick it off. Can you tell us about your upbringing and family life and things like that before you even got into medicine?
Yeah, absolutely. So I grew up in India. Sorry, sorry about that.
Yeah.
So I grew up in India, and so all my schooling and my medical school, everything was in India. When I was in my high school, I had my friend. His dad was an oncologist, and when we used to hang out and study, I used to see he was so passionate about medicine, and he had so in India there is a system where your patients can visit the physician's house. There's a small clinic where after hours to help patients with symptoms. They do it till 10 at night. So I was amazed by what he was doing, and the patients were really sick. And I don't know, I just got to know a little bit of more about the patients there and what he was doing. And that sort of, I always wanted, even before joining medical school, I knew I always wanted to become an oncologist and to spend time with patients. That was my passion, and that's what started the whole medical journey. And my med school was in India, and it was great. And then after med school, you think about, okay, what next? And I know fellowship everywhere is hard, and especially it's harder as a person from India somewhere else. And we know that the United States offer the most the world's best cares for patients and the best absolute research, and the evidence-based care. I think that originated here, and I was just amazed. So it was challenging. I didn't know that I would get into a residency program here, but I just wanted some challenge in my life, and I explored, started studying for USMLE, did okay, and did a couple of interviews. And then I did some rotations at the University of Minnesota here. I met with Dr. Emmy Lu. I did research with him for 6 months, and I was set on my oncology path since then. And I did my residency at University of North Dakota in Fargo. And then I'm here now for fellowship.
Got it. So going back to when you were growing up, that's kind of bringing personal urgent care to a new level. Essentially,
Yes,
home clinic in your new house.
I know. I think it's still there, and I don't think the HIPAA exists there. The doctors still do that there.
Interesting. Which part of India did you grow up in?
I grew up in Kerala, South India,
Okay.
city called Cochin.
Okay.
Yeah.
So it sounds like you certainly grew up with this medical aura really fully in the house.
Yeah.
Did you ever consider doing anything else, or was it just medicine all the way?
Um, I think I was very good in math. So my mom used to ask me, why not, do something in math? But I think I like connecting with people, talking to people and getting to know them. And I get a lot of, happiness after being able to help patients. And, I'm just more, I think, a people person rather than just sitting in the computer working. So I think that's, yeah, pretty much that I was set on medicine for a long time that I can think of. Yeah.
Yeah, and then it sounds like both from home back in India and then working with Dr. Liu, who's amazing as a
Yeah.
clinician and connecting with patients. It sounds like, as you said, oncology was set from there on forward. That was
Well,
the plan.
and I feel like, oncologists are more down to earth. I mean, I've had my family does have gastroenterologists, cardiologists, like my first cousins, and they've been in US, and and then there is a special connection that I always felt with the fellow oncologist. I feel like I don't know, it's just the personality or how we approach things, and you have to think as a person in a whole, and rather than just fixing a stent with a stent or things like that. I think that part of me is what I wanted to do. I don't think I could just fix with a stent and not see the patient anymore. So sort of like, and it's like sort of like primary care, and an oncologist is pretty much the primary doctor for the patients. And I think that's the part that I always loved.
Mm-hmm. Yeah.
Yeah.
So you have a lot of medicine in your family. I do as well. And speaking to the procedural aspect versus maybe the more long-term relationship aspect, my brother is a neurosurgeon, and so I would not
Okay.
want to do what he does, and he would probably say the same about me. And so
Yeah.
to each his own, I guess.
Yeah.
I'm glad that you found a place that really resonates with you.
Yeah.
You get fulfillment, it sounds like, from
Mhm.
not just a job, but really a calling.
Yeah. Mhm.
So it sounds like you obviously had a little bit of exposure to our faculty, at least,
Mhm.
in doing research with Dr. Liu. But what
Yeah.
really attracted you, bigger picture, to our fellowship program versus somewhere else?
Yeah. So I mean, I spent at least 6 months here doing rotations and then back again for some research here. I've met with the senior fellows, senior residents. Everybody only had to say good things about the program. And I also felt like the program was more welcoming to people with color, and when you come from different continent and you're here getting used to things, I felt that, no, I felt that I sort of would fit in the program right when I came, since the day I came in as even um, when I was doing rotations as like an internship and a rotation here. So that was the one thing. And the faculty that I've worked with, Dr. Liu, I've worked with Gynong team, Dr. Melissa Geller, and Dr. Teo, and everybody was so nice. With the fellowship interviews, and I really liked speaking with Dr. Blaze and Dr. Tata, and the opportunities here was amazing. And I think this is one of the best programs. We have more complicated patients, but we have other community places that we go to as fellows, the 3 places that we go to, a lot of exposure. So, for fellows who are not just focusing on the research track, more clinical track, I think there's a lot of opportunity for clinical track. Yeah, that's what pretty much attracted me to the program.
Yeah, I think that you make a great point in the fact that this isn't just all in an academic center, which will bring you the complicated patients and the exposure to curative therapies or
Yeah.
cutting-edge therapies and novel approaches, but you actually are also going to get to see the VA, where you really veterans care, which is really important, particularly in oncology.
Yep, absolutely.
But also regions, a high functioning, really busy, but much more clinically focused endeavor. So people can really know theoretically what they're going into.
Yeah.
Have a better sense of what are people's lifestyles like if you choose at least one of those 3 options, which are give you a good breadth of what oncology care looks like in the community.
Yeah, absolutely. Yeah.
Yeah. I'd love to hear about your research. Tell me about what your pathway is in that angle.
Yeah. So initially, with Dr. Liu and Dr. Geller, I was doing retrospective studies with gynonc, ovarian tumors and circulating tumor cells. This was back in, I think, 2014, and where the circulating tumor cells were a big thing, and it was just starting to do, and we were doing some research on that. I've realized after working for so long, I'm not a bench research person. I like to be outside, like talk to patients and interact with people, and working in the hospital and the clinic is my cup of tea. So right now, I'm still doing GI based retrospective studies. And also I've sort of found an interest in breast oncology too. So the breast and the GI are my most main focus, and more cancer survivor research, cancer survivorship research, and retrospective studies is what, looking into this chemo is working and what was the side effects. the time toxicity and those kind of things is what I'm doing right now.
Mm-hmm. And survivorship is obviously a really strong suit of ours. Having done a little bit of research when I was a resident here with Dr. Blaze and Dr. Kareem Sadak on that aspect as well. So
yeah,
you're in with the right people.
yeah. Thank you. Yeah.
So who, whether it's here or elsewhere, who would you consider to be mentors for you, and how have they helped you mold yourself into, or how they help mold you into who you are now?
Yeah, so I think my first mentor is my friend's dad. I don't know, just he was such a down-to-earth person. He was so caring, and he would go above and beyond to treat his cancer patients. And I always have looked up to him, and he set the bar really high. um, and then after coming here, I think the two people that I would want to say my mentors are, who would check in with me and see how I'm okay and how things are going, Dr. Lou and Dr. Blaze. So those are the two people that I would say are my mentors. And I, sometimes you sort of try to do a review article or an abstract, and it's not easy. It's just take a long time, and you get pulled between the clinical rotations. And I feel like Dr. Lou has been really helpful connecting me with the right people to proofread and to come up with suggestions. So that was great. And Dr. Blaze has also helped with, what can we do with the time that we have for the research, what sort of things was feasible, and to think about that, rather than sometimes you just think about, oh, well, this is a good project, but you never think about, okay, the time that is needed for that. So I think that she's really helped me understand what my goals are. And so, yeah.
I was going to say, you want to be able to, and I'm guilty of this as well, getting excited about a project and then getting too deep into it and realizing that it is more challenging. And to some extent, there's a learning process of saying that you have to get out of it, right? And I know we generally don't like doing that as clinicians, and arguably mostly type A people, but sometimes you've got to do yourself a favor and say, I'm not going to be able to bring the best of what it is here. But I also think, and I know certainly Anne well enough to know, she has a really good vision for what's the big picture, right? What is, this is a project and there's value here, but also make sure, for the sake of time, if nothing else, make sure that it's helping out, it's helping you in some way in the larger, vision. It may even be a bit oblique from where your career path is taking you, but you're learning something. You're learning some research process, or you're learning some analysis of the literature, some methodology there that you can bring back to who you're going to be.
Yeah, right.
And I think that's really important for mentors. They may not even be in your field, or as you said, they may be from long ago.
Yeah.
But you gain life experience and bring that to your own career path. I think that's what it's meant to be. It's not going to be so long before you finish fellowship. What are you thinking is going to be the next step for you?
Yeah, so I think I prefer to be in a semi-academic center where I can still teach. I think we all, I feel like as a physician, you learn more when you teach others, whether it be medical students or residents or fellows. So I'm hoping to work in a semi-academic center and more community oncology, so that like I said, I really wanted to do breast and GI oncology, but I think I'm also okay with benign hematology. I think I sort of get that, and I'm better than some folks. I think so. Don't like it, but I always liked the reading benign hematology. So I think I can do all three of that. So that's what I wanted to do. And I see myself in a community practice.
Got it. So yes, we could always use more classical hematologists. That's a that's a bias of mine. I think so. It sounds like to me, there's potentially some research out there for you. It won't be bench in the long term, but it will be something that is really patient oriented, and able to be broad, sort of broad reaching oncologist.
Yes.
Got it. If you were to say, push that out 10 plus years, is it, do you see yourself in I don't know, where do you see yourself? Leadership of some sort, or I always like to have steps in mind that whether or not you get there, you at least have a vision.
Yeah.
Next.
Um, I don't think I would be more interested in leadership. I think that's um it is something that I've always felt overwhelmed. I was a chief president. I think it was great, but I felt overwhelmed. I rather like to be, um, I'd rather love to do my work and not be able to manage things other than that. I think I would be good at that. I don't know. I haven't thought about leadership roles.
Yeah.
Um, you know, you gain experience, you gain confidence as you work, as you move on. And if there is something that is open, I always keep myself, try to be open-minded so that, opportunities come and take that. But yeah, right now, I think I would be just a community oncologist, maybe teaching residents, working in the both hospital and clinical setting, be able to do some research, able to provide clinical trials and be part of those at the community places, and yeah, part of some prospective, retrospective studies in the community that happens. So that's what I'm looking at.
Yeah, and that's a huge value, especially for the patient level, right? And
Mhm.
I argue this with a lot of colleagues and certainly trainees, is the fact that there are roles for everybody, and they're not always the same. And I haven't patients don't come to me asking what the sort of their biochemical measurement is, this or that. They want, in my case, they're asking for unbiased health equitable care.
Yeah.
And in oncology, they're asking as much for honesty, approachability.
Yeah.
We're on this road together. And that's what they see. They see you more than the
Mhm.
system, or you are the representative of the system. So in that way, you are leading.
Yeah.
But also you're a leader. You could be a leader by having that clinical trial open, right? That you don't have
Mhm.
to refer them somewhere else and
Yeah.
feel like you're out on a limb because you just don't have the best opportunities available.
Yeah.
So I totally get what you mean of
Mhm.
we classically think of leadership as running a clinic or whatever, but leadership means different things to different people. And in this case, we're talking not just of system level people, we're talking about
Mhm.
patients and
Yeah.
families. So,
Mhm. Yeah.
well, good. Well, we talked a lot about work. I want to kind of hear what is your life outside of work like? What are the things you enjoy, hobbies, etc.?
Yeah. Um, so, I used to dance a lot during my school days in high school and college, uh, sort of like Bollywood dancing, and I was part of all of that. Um, I think I don't know, that sort of passed me now. I live with my husband and my daughter. I have a toddler who I have to run around all the time. And she's 2, and we enjoy time with family. We love hiking and biking, and I've recently gained more interest in reading books. So I've been reading more novels, more fiction lately, and I think I enjoy that. Um, and beyond that, I think I love doing yoga and exploring um, oneself, meditation, and that's something that I try to do to connect with myself and to stay grounded. So those are kind of things that we enjoy, and we enjoy going out with toddler activities.
Those will keep you busy.
Yeah.
Having 2 kids of my own, yes.
Oh, yeah.
Um, and it sounds like you've got a good core support system at home, but even you have other. Obviously, I presume you're close to your family. Are they back in India? Is that what?
Yeah, my mom are back in India. I have my sister. She's in California. So we're pretty close. She was in Minneapolis. She was doing her master's in her engineering here. So we were here together, and that was nice. She just moved for work. Um, and my cousins, I have several cousins in California and Portland. So that's where my home that I would call here in the United States. Yeah.
Well, good. Well, and it is good, particularly when you're long distance. And I've heard this from other of your colleagues who've done these. Is it's nice to have somebody closer to home that is
Oh
if
yeah.
nothing else on a at least a closer time zone. So you're not
Yeah.
calling halfway across the world.
Yeah.
Well, good. Well, you obviously have been exposed to medicine since you were very young, and it sounds like this was kind of in the cards for you, maybe. But if you weren't a physician, what would you be?
Um, I think I would be good, like a maths teacher.
Okay.
Yeah, I think I would be good at that. And yeah, like I don't know, like counseling, and I like to give advice to people. I don't know if that's even a job, but like sort of
It's
like
teaching. I mean,
yeah,
I hear you as an educator. I mean,
yeah,
you've come around to that a couple of different topics. You're an educator. I hear it.
yeah.
So,
Yeah, that's or something with dance profession would have been my
well, again, your toddler is keeping you active, so at least you'll
yeah,
have your flexibility,
yeah.
and that's plenty to juggle. And then I think the last question I like to ask folks is, if you're a travel agent, where would where should I travel and why? Where would be one place that you would tell me to go?
Well, I think you should go to India.
I have
And
never been, so I will take, yes.
yeah, and I would suggest, I know people think about India. India is huge. South India is so much different from North India. Now I live in a place where there's backwaters. It's near the ocean. It's the bottommost part of the country. Um, it is beautiful out there, and there's a lot of things to do, water games and backwaters, and time to relax and good food. Yeah.
I'm always a sucker for good food.
Yes,
Um,
and states in India has different cuisine, and it's not the typical that you get here. The restaurants, it's a little bit different, and we can always adjust, the spice levels and things. And there's so many mild things too. I realize that.
That is
um,
wonderful. Yeah, I'm not from Minnesota originally, so I have a little bit more tolerable palate. I'm from Tennessee actually. A little bit more
yeah,
tolerable palate for spice than many up here. But
yeah,
I would still bet that it might overwhelm me. If unless I were eating it on a regular basis. So
yeah.
anyways, well, thank you, Minnu. It's been a pleasure. I know you're busy, but I really appreciate you giving the time and telling us a little bit about yourself. So
Yeah, thank you so much. I think this is great. Thank you, Dr. Bush.
yeah, have a good rest of the day.
Bye.